Hi, I'm Dr. Joe Sirven. I'm on the editorial board of Neurology Now. I'm a neurologist who specializes in seizure disorders, and I have the pleasure of sitting with Dr. Lisa Schulman. She's a professor of neurology at the University of Maryland, and she is an expert in Parkinson's disease. Not only is she on the editorial board of Neurology Now, she's also editor-in-chief of the Neurology Now book series. And Lisa, it's a pleasure to sit down and chat with you this morning.
Me too. It's a pleasure to be here.
Your area of expertise is Parkinson's disease, and I know a lot of folks just want to know, what is Parkinson's disease?
Parkinson's disease is the second most common, we call neurodegenerative disorder, with about 1 million people in the country who have Parkinson's disease now. Now, the most common early signs, oftentimes it is a tremor at rest, oftentimes of one hand. And one thing people don't realize is that Parkinson's usually starts on one side of the body, so that people slow down, become kind of more stiff, and their mobility overall just isn't as fluid as it used to be.
A lot of people, obviously, because they're worried about the tremor or about falling, they worry, do I exercise? Where does exercise fit into this whole equation?
There have been now close to 200 clinical trials of various sizes, of course, showing the benefits of exercise. And our group at Maryland actually has participated in this work. And just to give you one example. So in our study, we compared 3 kinds of exercise, because if you're thinking about, well, what kind of exercise should I do? It's important to know what would be some things that are effective. So we compared 2 groups did treadmill. One group did treadmill at really high intensity, and the other did treadmill, walking on a treadmill at their normal pace, like they were walking on the ground normally, but for long periods of time, like 40 minutes. And the third group did muscle strengthening exercises with resistance machines. And we were interested, well, which one of these is going to be most successful? And the funny part of this was that, you know, whenever you do a clinical trial, you have a hypothesis.
Yes.
And so we made our hypothesis, and which would you think would be the most effective of those 3 groups?
I'd imagine, I would always think that because exercise seems to be the answer to everything, that the higher exercise level would have been the one that did the best, but I don't know.
That was our hypothesis, but we were wrong.
At least I'm not alone.
Right, so it shows you the value of a clinical trial. You can't jump to conclusions. Right. So it turned out that our primary outcome measure was how long a distance somebody can walk in 6 minutes. It's called the 6-minute walk, which has to do with gait speed and endurance. So it turned out that the most improvement in that 6-minute walk was with the lower intensity treadmill.
Really?
However, also the other 2 groups also showed improvements.
Wow, wow.
So that was surprising, but we also looked at outcomes of endurance, which has to do with oxygen utilization, aerobic fitness. And another outcome was muscle strength. And that was also kind of cool and exciting, because in terms of endurance, which group now do you think is going to do the best? You'll probably get this one right.
Again, I'm going to go with the high exercise, the high intensity exercise.
So this time you're right.
Yay!
But it turned out that there was no improvement in the muscle strengthening group, but the lower intensity treadmill and the higher intensity treadmill both had improvements, good improvements in endurance, proving that our Parkinson's patients are couch potatoes. So just having them walk on a treadmill at a normal pace was aerobic exercise. One more piece of this, so I want to ask you one more question. I haven't finished my quiz. So now the muscle strengthening is another outcome. So of the 3 groups, which group had the greatest improvement in their muscle strength?
I'm going to say the resistance, and I don't know how they were kind of divided, but that's the one that kind of comes into my direction.
And that's intuitive, and you're right. Do you think that the people who were doing the treadmill exercise for 3 months, 3 times a week, showed improvements in their muscle strength?
My answer would be yes. I would have thought that they would.
And that was the other thing that was surprising. You can spend all that time, months, training on a treadmill or walking, cycling. You don't increase your muscle strength. You need resistance exercises.
Wow, wow.
So the key point, if you're putting all that together, is that different kinds of exercises have different outcomes. You have to do the combination. And the other thing that was a very important thing for anybody watching to hear is that, you know, you don't have to increase your exercise to really high levels to get benefits. We showed just simply walking for longer distances had benefit.
Well, Lisa, thank you so much
You're
for helping. I love taking my quiz for today. Now I've learned what I need to, and thanks again for sitting down and talking to me.
You're welcome.
Appreciate it.